Joining us now from the National Ambulance Service is Richard Quinlan, Chief Ambulance Officer, and Richard is from the North Leinster region. I suppose there's a few things we're going to be talking to Richard about, and in terms of the COVID response that the National Ambulance Services has undertaken, not any different, I suppose, than any other commitments that the other services have done. Richard, you're welcome to the programme. You're out and about again this morning, actually, in terms of with the tents and so on.
Yes, Declan, good morning. We have a pop-up site currently this morning in North Dublin area in conjunction with the CHO for the area and the community testing. Again, it's literally on a daily basis now. We would put up pop-ups depending on the location and the request from each of the areas. But yeah, this morning at 10 o'clock, we started testing again in another pop-up site.
Okay, Richard, I suppose to the operational side of the National Ambulance Service during COVID-19, we've seen the news of the efforts and the commitment that the ambulance paramedics and staff are undertaking. I suppose just a brief background, even from your own region, what personnel are up to.
Yeah, so nationally, our national director was tasked to engage in relation to testing in early March, as we're a long time ago now, as we're all well aware of. And we have been able to escalate and increase the testing from a number of aspects through the support of the operational staff, the business support staff, the administration staff, the HR staff. Early in March, we were asked to do what was called home testing, and it's been referred to as home testing now, where a paramedic will come to your house and do a test because of the way you've been selected for your test, and it's generally down to somebody who isn't mobile or is unable to get out of the house or is just that ill that they can't leave their house. That started in March, and it has continued on a daily basis across the entire country. North Leinster I can talk about. And there's testing every single day in people's homes where the ambulance car will arrive, and a paramedic or an EMT or an advanced paramedic will go into your house and do your test after you've booked it through the system. And that then escalated slightly, of course, as things started to ramp up, and we were asked to engage in relation to static sites. And it seems like a long time ago now, where there was a ship on the quays in Dublin on Sir John Rogerson's quay, and there was thoughts that the whole city was going into lockdown and there was going to be martial law, and all it was a facilitation of a pop-up site, which was very effective and worked very, very well. And then static sites started to work out of that. And again, that was in conjunction with each of the CHO areas, the community testing, and with our public health colleagues, that if they felt there was outbreaks or clusters that needed to be managed, we were asked to engage, that we would put a facility in. It varied from, as you're all aware, Croke Park, Aviva Stadium, you had numerous car park sites, so that varied. Then, needless to say, we had the nursing homes where we were asked to engage in the mass testing and what was deemed then serial testing in nursing homes. And since then, it has continued within meat factories and industrial facilities. And that's basically where we will get a communication, again, through our national office, through our national director's office, to engage in testing on a site. And we'll put teams together, and we actually nicknamed them the swab teams as opposed to SWAT teams, because at one stage we had so many interagency groups from the Army, the Navy, CHO hospital areas. We had dental staff, we had nursing staff that weren't able to do their own roles but were involved in testing. And that did get to a volume, and I can only speak for North Leinster, of on several occasions we had over 120 people leaving to do testing, and that's where you saw the mass vehicles heading off doing testing. That continues, but thankfully not at such a volume. We continue to do serial testing, and now there's the addition of what we call outbreaks, where a new cluster occurs, there's an outbreak in a community, and basically the public health and occupational health, for that matter, will decide that there needs to be testing of a volume of people. We will engage along with the community teams, and very, very quickly you'll see a number of vehicles or a site like a GA pitch, a car park. Like this morning, we're in the car park of a shopping centre. So they will pop up, and through the interagency work and the interdepartmental work, people will get appointments, they will be given the location, and they'll turn up for their test, and it'll run through the entire system all the way to back as far as track and trace.
And Richard, I suppose it must be an awful strain on the ambulance personnel as well, across the board, of the work commitments and the rosters and the hours and so on. It must be very, very disheartening for them to see all these anti-mask wearers and all these protests. Is there any feedback in terms of that? Now, and I know that wasn't on the list of questions, but just what you were talking about there, is there any sort of feedback? Is it very disheartening for them?
We've seen all of the different the anti-maskers and the different events that occurred over time in pubs that were open and in facilities and things. For all of the staff, it's not about that. For us, it's about the patient primarily, and it's about being able to support our colleagues in community, our colleagues in public health, our colleagues in contact trace. And we wouldn't even engage in that side of it. We want to do the job, get on with the job, and make sure that we can say, hand on heart, that every day we go home, we've made a difference.
And that's what it is across the board, even from the community engagement officers to other staff as well. It is a huge effort across the board, and huge thanks to the ambulance service for all the work they're doing in that. I suppose in terms of equipment and vehicles, the ambulance service, the National Ambulance Service, has brought on board a number of new ambulances to the fleet and have disbanded a few ambulances. Is that correct?
Yes, Declan, just before we go on to that, just like you said, the support, the interagency support we've had from absolutely every department, and our CFR volunteers as well across the entire country. It's been fantastic, and it's been a huge team effort and a team approach, and everybody needs to be thanked for that, for literally putting any differences anyone might have aside and getting on. And it's about the patient as far as we're concerned. In relation to your question on the fleet, yeah, and again, through the National Director's Office, there is a national fleet plan and development plan across the entire country. And currently, and again, not Leinster I can speak about, we have removed some of our older fleet. So we started with our 151 and our 152 registration vehicles, which would have higher mileage on them. And those vehicles are being decommissioned now, and we're introducing 202 emergency ambulances. So that's the primary objective, is to make sure our frontline is where it needs to be, with vehicles, with support vehicles, and with operational vehicles. A number of new vehicles in North Leinster. In the last 3 months, we introduced 13 new 201 regs early in the year, and we've just very recently, in the last couple of weeks, introduced another 11 202 reg vehicles in North Leinster. And what we've also done is we've kind of utilised the vehicles for a small bit of advertising. So you'll see the newer vehicles have the sepsis mnemonic on the side of the vehicle to remind people about the difficulties of sepsis and the concerns and awareness of sepsis. And that was done again through the national office, and they'll be seen on all the new vehicles across the country.
Very good. And just a few comments which are coming in there. Protecting our people and our services. The ambulance service are doing excellent work. In relation to the ambulance service, only for the ambulance service and the medical service, Ireland would be in a far worse place. Then another few questions or messages there. I suppose in terms, the ambulance service as well have given a COVID thank you to ambulance service staff over the past while. Richard, this is a national sort of initiative, is it, or is it just in different areas? Or
no, again, Declan, through the National Director's Office, it was a brainchild of Martin Dunn, our National Director, who basically felt that we needed to thank staff in a manner that would reflect the commitment that they've made throughout this, and the commitment at no stage. This is a tiny token of appreciation, because it doesn't half or even a quarter reflect the commitment people have made across the entire country. And it is a national operation that's occurring, again, through the national office. Our national director has disseminated down to each of the chiefs, and over the next while, everybody that has worked through the COVID pandemic will receive one of these tokens. And it is, again, it's only a small token of thanks, because there's no way we could thank everybody in the way they should be thanked for what they've done.
Absolutely, and it's a recognition of the work and the efforts that everyone is doing. Richard Quinlan, Chief Ambulance Officer, North Leinster Region. Thanks very much indeed for taking the time, Richard, and we'll talk to you again. Thank you very much indeed.
Very welcome, Declan. Thank you.